Thank you for joining us today. I'm Dr. Crystal Brimer. And to give you a little bit of background about myself, I own a private practice in Wilmington, North Carolina, and 90% of what I do there is dry eye. Now, this was not necessarily by choice, but I'll tell you how it happened in just a minute. Basically, over the last 3 years, I've co-developed the Dry Eye Protocol Initiative for Vision Source. And this required a lot of in-office research and trialing and really determining what's the best way to tackle dry eye. And what we realized very quickly is that the key to successful outcomes is actually in the diagnostic process, to accurately diagnose all the underlying contributors for this ocular surface disease. So now when a patient comes into my office, I immediately tell them, today we're going to do something different. We're going to find out what the underlying cause of this problem is. Is it not enough water, not enough oil, allergy, inflammation, bacteria, lid function, something systemic, something environmental? And then we're going to pair it with a treatment that I know works. As far as disclosures, I do consult and lecture for multiple companies. My biggest disclosure, though, is that I get really excited when something works. And sometimes I have a problem toning down that excitement. So as we get started, I want you to ask yourself, why are you listening to this today? What is your goal? What do you want dry eye to look like in your practice? Do you want to go all in and create referrals and growth and be the place to send patients? Or do you just want better outcomes so that that patient gets out of your chair and you can move somebody else in? So be thinking about that. And the reality is, you don't have to embrace it, but you can't ignore it. Dry eye is so prevalent at this point, and it's only going to get exponentially more so. But it's in your chair over and over and over throughout the day. Whether your motivation is outcomes or revenue, you have to start in the same place. If you create better outcomes, you will create increased revenue. You won't have much choice about it. It happens. And if increased revenue is what you want, you have to start with creating successful outcomes. And though my practice had a dry eye focus from the beginning, it quickly developed into its only focus almost, its primary focus. And this somewhat unintentional transition was propelled by outside referrals. In fact, I didn't track it initially, but by the end of the first year, and without marketing, there were 29 area doctors referring to us for dry eye evaluations. And that led to, of course, increased revenue. The outcomes create the referrals, creates the growth, creates the revenue. Because I looked back on this that first year and I asked myself, how'd this happen? These referrals were cultivated by word of the incredible outcomes patients were experiencing. And it was a beautiful thing to watch. So again, I looked back and I said, well, how did I get the outcomes? How did this happen? And it became very clear to me the consistent outcomes came from a very specific combination. When this diagnostic formula was paired together with targeted treatments and delivered to the patient with clear education and demonstration, it produced compliance. Compliance is the essential element here. You cannot do it without compliance. But without that focused patient education, you're not going to get the compliance. And so combining these elements with this fundamental shift in mindset became this undeniable recipe for success. I diagnosed them and I educated them. They followed my recommendations and they got better. And watching this process unfold, it changed how I talk to patients drastically. My words, my tone, it changed my conviction, my confidence. And this is what influenced their conviction and their confidence in the plan, and thereby their compliance. And what happened from that was pretty phenomenal. The referrals, the growth, the income. So I can tell you firsthand the formula works. The reality, though, is that it was not originally a quick process by any means. And knowing this would be the biggest roadblock to implementation, I approached OCULUS, and together we redesigned their software to streamline the acquisition of data and created a report that allowed the patient to see the test results and the recommended treatments all in one place, to really know where they stood, what their status was when it came to each of those categories that I mentioned. Now, as far as the hardware of this device, it's an imaging system that creates high-resolution photos and videos with 3 different magnifications. And then dependent on the light configuration that you choose, you can allow the patient to visualize the amount of oil in the tear film, their meibomian gland structure, as well as fluorescein staining and imaging and tear film debris. The other mainstream device in dry eye diagnosis comes from Tear Science. The original version is the LIPIVIEW, and it allows the patient to see when they don't blink completely. So a very easy to understand partial blink assessment. It also gives a lipid layer thickness, so an actual number that represents the amount of oil in the tear film. Now you can also visualize the color in the tear film like you can on the 5M. The more color, the more oil that's in there. And it does meibography. The LIPISCAN, which is the smaller footprint, the newer device, only does meibography, but still could be a very useful screening tool to do on every single patient that walks through the door. And that is an important key to developing a dry eye practice, or even a thriving primary care practice. We have to be looking for dry eye in every patient. If we wait for symptoms to surface and patients to complain, then we've potentially missed the opportunity for early intervention. There are many, many ways that you can do this. The key, though, is picking one that you can repeat on every single patient every time they walk in the door. It doesn't matter if it's a routine exam, new patient, established patient, follow-up, something you routinely do because it's that easy, and at that point it's hard not to do it. So pick something and be consistent. In my office, I use the 5M to conduct a screening, and the reason I do it is I want to give them something to walk out with. So it consists of 3 tests, and in my mind, it represents water, oil, and inflammation. So I start with the tear meniscus height, and I can make the actual measurements there on the screen. Then I do a non-invasive tear breakup time, and I like this because I can show the patient how it relates to their vision. When their tears break up and you see the Myers getting distorted on the screen, this is the same thing that's happening to your vision looking out. That's why you have to blink so frequently. And it connects the dots for them so that whether or not their vision is impaired now or affected by dry eye, they understand that the reality is it could be later. And then a redness scan so that I can assess inflammation. So I do this on each eye, and they walk out with a crystal tear report, the screening version. So it has their test results, and it's color-coded according to the severity, definition of the 3 tests, and then some background information on the tear film itself, as well as symptoms to look for, and the fact that you don't always have symptoms even though there's some surface issues that are present. If nothing else, it plants a seed in that patient's mind. So whether they do something differently this year or not, it opens up that conversation for later. And also, if they start having symptoms throughout the year, it might spur them to come back sooner as opposed to sweeping it under the rug. Whatever you choose to do, find something that works for your flow, your office, your staff count, but do something to prove that that patient doesn't have dry eye. If you don't, you're going to miss the opportunity and possibly compromise their long-term outcome. The reality, though, is you're not going to lose money by doing this. Take care of the patient. Put the patient first. The money will follow. This is an assessment that was done according to just some general epidemiology numbers, and it says that, all right, if you've got 2,500 patients in your practice and half of them have dry eye, and you convert 35% of those to come back for a dry eye eval, and you treat them accordingly, that could add $215,000 per year to your practice revenue. $18,000 almost per month, almost $600 per day. So that potential is real, and I have lived those numbers. The point I'm making here is don't think for a second that by taking care of that patient and diagnosing the dry eye early and implementing treatments that you're going to miss out financially because you did it. But to get the outcomes needed, it takes compliance. To get that, it takes patient education combined with the right diagnosis. So we're going to spend the rest of our time together talking about what happens during this dry eye evaluation, What information do you need to collect, and what do you do with it? Always, always bring them back. Don't ever try to assess their dry eye during a routine exam. It needs more attention than that. Make them understand that it needs more attention than that. They walk in the door, and I literally say this phrase half the time. Everybody knows you have dry eyes, so what? Today we're going to find out why. Is there enough water, enough oil, allergy, inflammation, bacteria, lid function, something systemic, something environmental? I'm going to do tests, more than one probably, in every single one of these categories. Whatever is positive, I'm going to pair it with a treatment that I know works. It's not going to be easy, and a lot of this is going to depend on you. You're going to need to do the work. If you do, you will get the outcomes. Now I can say that and I can talk till I'm blue in the face. It won't matter if I can't show them. You have to take pictures. If you're serious about dry eye and you don't have any form of anterior segment camera, you're not serious about dry eye. Because it's one thing for you to be able to diagnose it, and all of us could at the slit lamp without any other equipment in most cases. But that doesn't create the compliance. The pictures do. Now, this is an example with the 5M, and what's nice about it is that it has capture advice for the technician. So she knows what that picture should look like, and it gives her instructions on what to do to make that happen. Also, you customize your work list so that you're telling that technician ahead of time, here's all the tests I want you to do, and all she has to do is follow the instructions. Click, 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 click. As soon as she clicks it, it goes to the next item in your work list. Once she's acquired all that, the next step is to tell the story. And that is why the 5M is so important to my practice. It's because of that story and the fact that I can tell it in 60 seconds or less. So I'm going to show you an example of my technician who has young, healthy eyes, but I'm going to tell you the story the way it would sound with a typical patient. I can show them both eyes at once, or I can show them just one eye. But I start with the water. See how your water's a little bit lower than it should be. And look at this lid margin. See how the glands are puckered up like little pimples? It's not letting the oil out. If the oil's not coming out of those glands, it's not getting into the tear film. That's why there's no color in this tear film. And because there's no oil in there, the tears are evaporating really quickly. You see how this is happening, and it's making you have to blink more frequently. And over time, this is causing structural damage to these glands, and it's damage that we can't undo. This is normal, and then here you are. We can't get those glands back. This is your lower lid, normal, and here where you are. What is in the tear film is a whole lot of debris, and this debris is causing inflammation. It's causing this redness, and it's also causing this staining on the white part of your eye caused by that inflammation. I can go over here and I can assess it. I can also show them one picture at a time so they can really visualize the details. Looking at the water, explaining why it's like that, looking at the lid margin for bacteria and gland issues, looking at that oil in the tear film, and then really diving into the fluorescein video. I always have them blink a few times, and I do this because I want to know, are they having partial blinks or not? So I come back and I slow the video down so that we can look at it together and they can understand the importance of correcting that issue. If there's a specific issue I want to highlight, then I can click on that line item. So in this case, the lid appearance. And I can talk about everything related to it. I can talk about rosacea, talk about meibomian gland issues and the line of marks that's pulling the dye in, talk about bacteria in the lashes, and show them all at once. Here I can show them all the staining at once, talk about the inflammation, talk about how they got here and what we're going to